Hey everybody! Thank you for jumping on our live video today. My name is Kerry. I am the Administrative Manager for the Michigan and the Northwest Ohio chapter for the Cystic Fibrosis Foundation. And I have with me a really special guest. This is my cousin Alexa, who actually has cystic fibrosis, and she has agreed to come in today to share her story with us and to give us some insight on what her day-to-day is like with having cystic fibrosis. Thanks for coming in today, Alexa.
Thanks for having me.
So why don't you tell us a little bit about yourself?
My name is Alexa. I'm 19 years old, currently going to school at Lansing Community College, doing online courses. I plan on going to school to become an EEG tech and maybe in the future pursue nursing. And
That's awesome. Well, why don't you tell us a little bit about your diagnosis? So how were you first diagnosed with cystic fibrosis?
So when I was born, I had a bowel obstruction. Then they had to go in for emergency surgery, and then they did testing, and then 2 weeks later, my parents found out that I had cystic fibrosis.
So at 2 weeks old, you had your diagnosis.
Yes.
That is crazy. And what has been like some of your biggest hurdles living with cystic fibrosis as you've been growing up to the ripe old age of 19?
As a kid, I was pretty healthy. Lung function was in like the 90s. Never had any lung infection really. And then once I turned 13, I was also diagnosed with CF-related diabetes.
Okay.
And then hospital admissions just started going, and then more bacteria in my lungs, and then lung function started declining a little. But definitely the biggest obstacle was this year, because I've been coughing up blood almost every week and then being hospitalized every month because of it. But I had the opportunity to go to Johns Hopkins and get a pulmonary embolization done, which helped for about 3 months, and then it came back again every week, and then I got a second one done at Johns Hopkins, and then it's been very limited blood, but I probably might need another one, but it's been really good.
It's been good? Oh, that's good. I'm glad the treatments have helped and that you're feeling better today than what you were a year ago, because I know that you really went through a lot and you were in the hospital a lot.
Yeah.
And I know that really impacted you, impacted going to school, like going physically to school, like how you really wanted to do. I know it really impacted your family as well to have to see you in the hospital all the time like that. What are your day-to-day treatments that you go through for cystic fibrosis?
So I do hypertonic saline, it's inhaled, and then I do palmazine, which is inhaled, and then I do an aerobica, which is a type of airway clearance, and then I do either a PEP device or I do autogenic drainage.
Wow, what is that like?
It's a breathing technique, but it really works for me, and I know it works for a lot of other people too.
That's good. I'm glad that it works for you. That's wonderful. So how do you, being 19 years old, you're very social, you like to meet new people, you have a wonderful personality, and everyone just loves you. How do you, when you meet a new friend, how do you explain what cystic fibrosis is to them?
I mean, it's not really hard to explain. I usually tell them it mostly affects the lungs, but it also affects your digestive system, and you get bacteria in your lungs, you have to get IV antibiotics. Sometimes it's hard for me to gain weight. That's another big obstacle. It's really hard to gain weight, and over the years they just kind of learn as I'm in the hospital and see what I do, see what I go through, and
Do you find that a lot of your friends are really supportive and
Oh yeah.
come visit you in the hospital and
All the time.
do they do their own research sometimes?
Oh, yeah.
Do you notice that
Yeah,
they'll
they do.
they'll learn about it on their own?
Mhm.
Do they ask you a lot of questions?
Not really.
No.
Mm-mm.
That's good. So if you were to be talking to somebody that has no knowledge of cystic fibrosis, what would you want people to know about cystic fibrosis? Like what's like the overarching thing you would like them to know about somebody who lives with cystic fibrosis every day?
Well, it's different for every patient.
Mm-hmm.
They call it the invisible disease
Yeah.
because it's not very known that when you look at me that I have a disease,
That's right.
and I think people need to know that,
Yeah.
and it's really important, and it needs more awareness
It
because
does.
I don't think it has enough, because it can be scary and dangerous and
Yeah, because there's only about 30,000 patients in the U.S. that have
Yeah.
cystic fibrosis, so it's not as well known as
Mhm.
what some other diseases like
Yeah.
diabetes and
Diabetes.
cancer
Mhm.
and things like that.
Mhm.
It also doesn't get a lot of government funding, correct?
yeah.
Yeah, so that's kind of where the foundation steps in, is raising money for the treatment and for the research
Yep.
for people with cystic fibrosis. So tell me, how has the foundation helped you over the years?
I mean, I think it's helped me in the same ways it's helped other people. It's helped try to raise enough awareness and make money to get new drugs like the ones that are coming out that are doing really amazing and having great results and
Yeah.
patient care, and it's done a lot for us that struggle every day with CF.
It's really great. And what would you like, or why should people today give to cystic fibrosis on Giving Tuesday? Like, why should they give their money to the Cystic Fibrosis Foundation?
I mean, because we go through a lot, even though it doesn't look like it.
Mm-hmm.
We go through a lot of pain and a lot of medicine, a lot of treatments, and a lot of hospitalizations and antibiotics, and it just takes a toll on your life, and we need as much help as we can get.
And what are your biggest dreams, like, for your future? Like, CF aside, what's Alexa's biggest dreams for her future?
Definitely finishing school,
Awesome.
get a good job. I would love to get married. I would love to try to have a family
Mm-hmm.
and do whatever I want.
There you go. I love that. That's perfect. So I think that the underlying theme here is that giving to the Cystic Fibrosis Foundation is going to help add tomorrows for patients like Alexa and give her the opportunity to finish school and have a family and get married and do whatever she wants. Also, I don't know if you've been seeing in the background, Boomer.
Boomer.
We did have Boomer as one of our, he was supposed to be our third person on the couch, but Boomer also helps Alexa out a lot with her hospital stays, which is wonderful, so I just wanted you to get a little taste of Boomer here. But the link is going to be in the comments or in the description. Please click on it. Please give as much as you can today to the Cystic Fibrosis Foundation. And we promise that donation is going to go straight to our mission to help find a cure for cystic fibrosis. Thank you.